Thank you very much. Your Excellencies, Your Royal Highness, Honorable Ministers, distinguished guests, ladies and gentlemen, good afternoon and welcome to this high-level session here at the Kigali Summit on Malaria and Neglected Tropical Diseases. My name is Anne Kiguta. I am a Nairobi-based journalist, talk show host, and gender equality advocate, and I'll be your moderator for this second and final part of today's program. What a fantastic day it has been so far. Throughout the day, we have heard from the survivors, from frontline workers, businesses and partners on the concerted push to end malaria and NTDs. And now, in this very final part of today's session, we will hear from our heads of state and government, and these are the people who will ultimately look to be custodians of their communities. Throughout the day, there have been critical conversations that we've had and critical deliberations. We know the road ahead, and we are equipped to take it. Here to present now the summit's outcomes and commitments is Rwanda's Minister of Health. Please welcome onto the stage Honorable Dr. Daniel Ngamije. Welcome, Minister.
Your Royal Highness, the Prince Charles, Your Excellency President Paul Kagame, Your Excellencies, Head of State and Government, Excellencies, Honorable Ministers, dear partners, esteemed delegates, all protocol observed. It is my pleasure to welcome you to this high-level session of the Kigali Summit on Malaria and NTDs. It is with great pleasure that I recount some of the outcomes and commitments from this morning's session. First, incredible commitments were made by malaria endemic countries on co-financing towards the fight against malaria. Over $2.1 billion of funding commitments were spotlighted through today's announcement by the Global Fund as domestic commitment made between 2021 and 2023. It is clear that as we head toward the 7th replenishment of the Global Fund this autumn, endemic countries have done more than ever before to show their commitment to fighting malaria. Second, the launch of the NTDs Kigali Declaration today is a major milestone in the road towards ending neglected tropical diseases. Your Excellencies, the declaration has already galvanized unprecedented political and financial commitments from countries and partners to deliver the WHO 2030 roadmap targets on NTDs. As of today, $1.9 billion has been committed by partners, 18 billion treatments donated by pharmaceutical companies to treat a range of neglected tropical diseases, and you'll hear more about this commitment from companies' CEOs. We thank all partners who have endorsed the Kigali Declaration. Third, we have seen a range of additional commitments from the private, philanthropic, civil society, and other sectors exceeding over $1.2 billion for research and development. Being joined today by so many leaders is a strong endorsement that malaria and NTDs remain a priority for our leaders. I know that several speakers will bring forward new commitments to our fight, which I thank them for in advance. Finally, I wish to acknowledge and thank all stakeholders, including academia, civil society, private sector, and others who demonstrated their engagement to end malaria and NTDs. I thank you.
Thank you very much, Honourable Minister. As you have heard, this summit has provided a historic moment for our leaders to renew commitments to endorse the Kigali Declaration and to mobilize a fully resourced global fund replenishment later this year. And so we are gathered here in beautiful Rwanda at a tremendous moment to push forward together as a global community and indeed as the Commonwealth family. We are deeply indebted to our next speaker. Where do I begin? Is it his tireless efforts in bringing us all here? Or is it for the incredible display of hospitality, true friendship, and distinct leadership? It is my singular pleasure to introduce our host and the chair of the 26th Commonwealth Heads of Government meeting. Please give a very hearty welcome to His Excellency, the President of Rwanda, Paul Kagame.
Royal Highness, Excellencies, WHO Director General, Mrs. Melinda Gates, co-chair of the Bill and Melinda Gates Foundation, BioNTech CEO, Professor Ugur Shahin, senior government officials, global health advocates, business leaders, distinguished ladies and gentlemen. First of all, a good afternoon to you and welcome to Kigali. Thank you for the comprehensive report we have just heard. Clearly, a lot has been accomplished during this summit. I want us to take a moment to appreciate the extraordinary coalition that has come together in this room. His Royal Highness, the Prince of Wales, who is also the patron of Malaria No More. Melinda Gates, whose foundation, in many ways, is the engine of global health progress. Mr. Tedros, whose extraordinary leadership of the World Health Organization is known to us all. Minister Shakbut of the United Arab Emirates, and Minister Assata Tarsar of Senegal, who represent the commitment of governments to tackle these diseases together. Professor Ugur Shahin, CEO of BioNTech, with a major commitment to developing and manufacturing mRNA vaccines in Africa. And of course, all of you in the activist and scientific community who have ensured that malaria and neglected tropical diseases get the attention they deserve. I therefore congratulate the organizers, uniting to combat neglected tropical diseases, malaria no more, and the RBM partnership to end malaria. This week, the Commonwealth will commit to working towards ending the malaria pandemic by 2030. We will need your support to make this happen. One key action item is to support the Global Fund's 7th replenishment. Today, we are also endorsing the Kigali Declaration on neglected tropical diseases. Alongside the WHO's neglected tropical diseases roadmap to 2030, we have a clear action plan. I am pleased that the WHO has recently confirmed that sleeping sickness has been eradicated in Rwanda. But we still have much more to do. Ensuring that all African countries mobilize the domestic financial resources required for quality health care is a priority for the African Union and our partners. If there is one thing the pandemic has taught us, it is that together, through coordinated and collaborative action, we can achieve much more. Thank you for your kind attention, and once again, most welcome to our country, to our capital, Kigali.
Please rise. Thank you very much, Your Excellency, sir. Thank you. Thank you. This summit is a summit of firsts, and here's the first for you. It is the first royal visit to Rwanda. Yes, and we are delighted that on this inaugural trip, our next speaker would join us for this very event. His presence here is proof that the millions in our Commonwealth who are struggling with malaria and NTDs are seen and they are heard, and that we are determined to beat this together. Would you please help me welcome to Rwanda and onto this stage, His Royal Highness, the Prince of Wales.
President, Your Excellencies, distinguished guests, ladies and gentlemen, I am most touched to have been asked to join you here today at such a pivotal time in our history. And if I may, I would like to express my deep gratitude to President Kagame and all those who have contributed to making this summit happen so that we can drive our collective energy even further forward. Human health, planetary health, and economic health are fundamentally interconnected. And the past 2.5 years have seen the world battle an unprecedented global pandemic that has, and in many ways continues, to impact the lives, livelihoods, and economies of communities right around the world. At the same time, climate change is causing the length of the malaria transmission season to increase in many parts of the globe. A recent study from the London School of Health and Tropical Medicine showed that if global mean temperatures continue to rise to 3.7 degrees Celsius by the end of the century, an additional 4.7 billion people could be living in areas at risk of malaria and dengue transmission. So here, the Commonwealth has a vital role to play. As president of Malaria No More UK, and building on this and last CHOGM summit, I continue to support our collective ambition to halve malaria by 2023. We must also acknowledge that the burden of neglected tropical diseases is also a hugely important issue. Such diseases are endemic in 46 of the Commonwealth's 54 countries, thereby representing 2/3 of the world's burden. So I very much welcome, ladies and gentlemen, the declaration that has been launched today. While we have achieved so much in the malaria campaign since 2000, I'm afraid that largely due to the COVID-19 pandemic, there remains a great amount to do if our ambitions are to be met. I can only hope, therefore, that today's meeting signals the necessary focus and prioritization of funding for novel therapeutic, prophylactic, and vaccine strategies against malaria. For example, I understand that the Global Fund to Fight AIDS, Tuberculosis, and Malaria reported that 188 million mosquito nets were distributed in 2020, a 17% increase compared to 2019, despite COVID-19. And there is a wider hope. We now have more valuable assets at our disposal than ever before. For example, the first WHO-approved vaccine, new nets, and modern communications tools to monitor our progress and fight against complacency. Your Excellencies, ladies and gentlemen, these efforts take bold ambition, concerted action on the ground with communities and partnerships across borders. And here, if I may say so, it is really inspiring to see so many Commonwealth leaders talking to one another to ensure that life-saving medical, material and preventative supply chains can keep flowing across our borders. Similarly, we know that this is a battle that is fought on the ground in local communities and by citizens themselves. In this regard, we acknowledge and give particular thanks for the tireless efforts of community health and prevention workers who each make such an important difference. And I thought there'd be quite a lot of you in the audience today, because you really are absolutely crucial and critical to this battle. So I hope this summit will give you some encouragement. So as we emerge from the pandemic, 2022 must be a turning point. Post-COVID-19, the world is paying greater attention to infectious diseases, and we must capitalize on this to provide proper support to prepare for and respond to infectious disease outbreaks. It is most encouraging to see that leaders of the Commonwealth will discuss and pledge their support for this campaign and are committed to work towards ending the epidemic of malaria by 2030. I very, very much welcome this determination and that we are not turning our back on a job unfinished. After all, ladies and gentlemen, the Commonwealth is uniquely placed to help the world in this effort. We need only recall the Commonwealth's commitment in 1987 to end polio and how close we are now to reaching that goal, even if we have faced setbacks over the years. We can achieve the same with malaria. Your Excellencies, ladies and gentlemen, these are challenges that affect us all as one people living on one planet. Therefore, to solve them for present and future generations, we all have a responsibility to come together to accelerate action and the scaling of solutions. Thank you, ladies and gentlemen.
Thank you very much, Your Royal Highness. His Royal Highness will be leaving us, but allow us to express our gratitude for joining us for this summit. Thank you very much. Thank you. Please do have your seats. Well, we were graced by her presence this morning, and how blessed we really are to have her join us again. Would you help me welcome onto the stage award-winning author Chimamanda Ngozi Adichie.
Distinguished ladies and gentlemen, good afternoon. When my daughter was born, I told myself that I will try very hard to make sure she did not get malaria before she turned 6. I had read somewhere that children are a little bit more resilient to illness after the age of 6. Because I knew how terrible malaria had been in my own childhood, I didn't want her to suffer as I had. So every day I would very meticulously spray her skin with insect repellent, her ears, her toes, her neck. And so instead of those deliciously innocent scent of babies, like fresh talcum and lavender, my daughter smelled of insect repellent. I often examined the mosquito window netting, checking for holes. A frequent refrain that friends and family heard from me when they visited our Lagos home was, "Mechuzo siso maka mosquito." Shut the door quickly because of mosquitoes. My daughter will turn 7 this October, and she has never had malaria. This, for me, is a very tiny example of what can be achieved when we put our minds to it. I remember a cousin telling me it didn't matter what I did, that my daughter would get malaria because, well, everyone gets malaria. Malaria is so common that we think we have to have it. But we don't have to. Malaria can disappear from our lives forever. Malaria has been eliminated in 40 countries so far, with China being the 40th this year. But for us in many parts of Africa, it has not. And malaria is not the only disease which needlessly plagues millions of lives. Many gains have been made in the fight against malaria, but we must keep pushing to the final finish because this parasite is very clever, which is why malaria has existed on Earth as long as we humans have. Now is the time for the final push. Now is the time for faith and for hope. Because to believe that we can end malaria and neglected tropical diseases is an act of hope. There is nothing hope. To have hope is to know that a future will be better than the present. It is to actively believe in a future. We have the knowledge. What we need now is leadership. Leaders who believe, leaders who have hope. It is easy to ask, if we can eradicate this, and if all we need is leadership, then why haven't we? It is not because leaders are bad people who want malaria and diseases to continue to ravage this continent. It is because leadership is difficult. It is about making choices, about challenges to budgets, about deciding what to make a priority. We must make ending malaria and other tropical diseases a priority because we know it can be done. We know malaria kills. It is catastrophic when a person dies of an illness, but there is an added pain and poignancy when that person dies of a disease that is completely curable. Across this beautiful continent of ours, so many children have died of malaria. Those children did not have to die. Imagine what we have lost as a community, as a continent, as a people. So many voices forever silenced, so much talent forever unused, so many ideas unformed, so much progress unmade. Still, a disease does not have to kill to have a profoundly debilitating effect on individual lives and on economies. The labor lost to the lethargy of malaria, the lack of faith and hope, the resignation that so many people like my cousin have, who believe that malaria is inevitable. We cannot create a perfect world, but we can create one that is much better than what we have now. Malaria and other neglected diseases have blighted our past and continue to diminish our present. We've had enough. We must refuse to let these diseases steal our future. And thinking of this makes me remember my beloved father's words. My father was a professor of statistics. I have never liked mathematics. And once I took practice exam papers to my father, and I complained about all of the problems that I could not solve. And he said to me, "Show me the problems that you can solve." And I did. And then he said, "When you get into the exam, first go through and solve what you are sure that you can solve, and then afterwards go back to the others and try solving them before your time is up." Our world today is bruised and battered by COVID. We are still learning about COVID, and it is of course imperative that we understand COVID. But we already understand malaria and other neglected tropical diseases. We can solve them. Sometimes it is an act of courage to believe that something that can be solved can in fact be solved. We need courage. If we eradicate malaria and other tropical diseases, our health clinics would be strengthened and would be able to focus on the things we do not fully know, on other diseases we do not yet fully understand. Because sadly, other pandemics will come in the future. It feels wrong, morally wrong, to know that we live in a modern world of self-driving cars and drones and visits to space. And yet, these ancient diseases, these diseases that we know can be conquered because they have been conquered in different parts of the world, are still killing so many people in the Commonwealth. This is the time to show what can happen with a collective will. And it has to be collective, because mosquitoes and those diseases do not recognize borders. We can, indeed, in the most literal sense, not only change the world, but change the world on a truly magnificent scale. Imagine what we would unleash across the Commonwealth, across this beautiful continent, if we eradicated malaria and other tropical diseases. We can craft a new future for our people. It can be done in our lifetime. We can make history as the generation that finally rid the world of these terrible diseases. And now is the time. Thank you.
Thank you, Chimamanda, for that reminder. It takes courage to save lives. Somebody who knows a great deal about changing lives is our next speaker. As the co-chair of the world's largest private foundation and also as an advocate for women's equality, Melinda French Gates has been consistently ranked as one of the world's most powerful women by Forbes. And she is using that power to do a whole lot of good, and we are delighted to have her. Would you please help me welcome onto the stage the co-chair of the Bill and Melinda Gates Foundation, Melinda French Gates.
Well, thank you, President Kagame, for hosting all of us here, welcoming us to the summit, but really for your leadership and your foresight, not just for Rwanda, but for the rest of the continent as well. We're so pleased to be here at CHOGM and to have this summit run alongside it because of its importance. So I also want to say warm greetings to all of the dignitaries and partners who are here in this room today. I am so happy to be back on the continent of Africa again, and it feels like an absolute honor to be here with all of you. Now, as I look out at this distinguished crowd, I'm reminded that there's one really important face that's missing. Dr. Mele Chela. She was at the World Health Organization as the director for many years of neglected tropical diseases, and she passed away earlier this year. And what I want you to know about Dr. Mele Chela was she wasn't just committing to ending diseases that are neglected. She worked tirelessly to make sure she was reaching the people who were most often affected by these diseases, and the people who are most overlooked. And I know that in this same spirit, it's what guides so many of us here in this room today. Now, over the past few decades, it's been really inspiring to see the way that leaders have come together to combat both malaria and neglected tropical diseases. Multilateral organizations, donor nations, pharmaceutical companies, and most of all, leaders across Africa and around the world, from government officials and health workers to advocates and amazing scientists. Thanks to these efforts, malaria deaths have been cut in half. Also, the number of people requiring treatment for NTDs has fallen by 300 million. That's staggering. Guinea worm has gone from infecting more than 3 million people a year to only 15. And no, I didn't make a mistake. Not 15,000, not 1,500, just 15 people in the last year were affected by guinea worm. And as you heard earlier, here in Rwanda, sleeping sickness has been completely eliminated. So this progress that we're talking about, it's remarkable. It's possible. It gives us reason, as Chimamanda says, for hope. It reminds us that when we come together, we can do something great. But we also have to be realistic that progress has stalled because of the last 2 years of COVID-19. So funding for malaria and NTDs has plateaued. Unfortunately, malaria deaths are rising. And while we have these amazing new tools and treatments which are emerging literally in the months ahead, they may not reach those who need them the most. So it means we all have to do more. And when I say we, I mean all of us in this room. There is absolutely no nation and no organization that can do this work alone. So for our part at the Gates Foundation, we're stepping up our commitment and we're pledging $140 million over the next 4 years to support African institutions in fighting malaria. Despite how devastating COVID-19 has been, I think one of the things we all came to realize as a community is that we have got to put Africans first, and that scientists as partners and leaders. So we will also be announcing that with our African partners and the institutions that are fighting malaria, we're going to launch a new philanthropic fund with 2 other partners in collaboration against neglected tropical diseases. That is the Children's Investment Fund Foundation and the Elma Philanthropies. They're both going to come into that fund. So in memory of Dr. Mele Chela, who understood what's possible when women and girls lead, she understood the resilience of women. She understood the women female scientists. She understood the women on the front line and how ingenious they were about giving messages and solutions to communities. So we're going to partner with the WHO to support a program to develop women leaders to combat NTDs. We're calling on world leaders to take 2 important actions. One, we're asking everyone here in this room to endorse the Kigali Declaration on NTDs. By 2030, we can eliminate NTDs in 100 countries. And second, we're asking everyone to increase their commitment to the Global Fund. If the Global Fund hits its $18 billion target, if the Global Fund hits its $18 billion replenishment target, malaria cases will fall by 2/3 by 2026. With this support, Africans and their partners can accelerate health R&D. They can use the smart tools and systems they have to track diseases and deliver treatments tailored to each community. They can strengthen the primary healthcare systems that save lives. And through it all, in the spirit of Dr. Mele Chela, we can make sure that the focus stays on those who are too often left behind. Thank you.
Thank you very much indeed. Very shortly, we'll be hearing from various heads of state and government who have so graciously joined us. But first, we are very grateful to have the scientific community with us today. We rely on their expertise to make millions safer, healthier, and in some cases, to give them a brand new lease on life. Founded by scientists and physicians, BioNTech believes in scientific rigor and passion, and so do we. So please help me welcome to the stage its CEO, Professor Ugur Sahin.
Excellencies, head of states and governments, distinguished guests, dear colleagues. About a year ago, we started our mRNA-based Eradicate Malaria project. It has 2 simple goals. The first goal is to develop a well-tolerated and highly effective mRNA-based malaria vaccine with a durable protective immunity. The second goal of this project is once approved, ensure a sustainable manufacturing and supply of mRNA vaccines from the African continent. Allow me to shortly explain the project. Why now? Now, because of the slowing of the progress in malaria eradication. Despite the success of the last decades in the eradication of malaria in many regions of the world, we are seeing that we are reaching limits what can be achieved with imperfect prevention tools. The second is a positive reason. It's the emerging understanding of malaria biology and immunology, and it's also the reason why we are engaged in this project. We can build on decades of malaria research funded by international organizations like Bill and Melinda Gates Foundation, and we can rely on the first understanding that immunological mechanisms could be useful to prevent malaria with the first approved vaccine and with antibodies showing preventive activity. So the question is, why us? As a company founded by medical doctors, the health of an individual one is what drives us. We are committed to bringing our innovations to those who need them. Thus, malaria is an obvious mission to us. Our mRNA technology has allowed development of an effective vaccine against a pandemic disease. Its flexibility, speed, production scales, and ease of supply may have a great impact on global health. Such a transformative tool has the potential to establish a new paradigm in the prevention of malaria and may thus enable us to achieve the vision of a malaria-free world. BioNTech has the will and the capacity to contribute to this goal. We will deploy the best science and work in partnership to achieve these ambitious but attainable goals. So what is our vision? Our vision aligns with the WHO's strategic view and aims to develop a highly effective Plasmodium falciparum blood stage infection prevention vaccine that at an individual level prevents disease and death and onwards transmission. We are immunologists. We believe that there is plenty room to develop an improved vaccine. We will not only test the vaccines and antigens which have been used previously, but also use new antigens. We aim to discover new antigens that can help us to attack the virus not only before entering the liver stage, but also in the liver stage. We want to start clinical trials by the end of this year. We had in the meantime tested more than 80 candidates and identified the first candidate for clinical testing. We have a date for starting our clinical trial, but we do not define a date for the vaccine to be ready. We want to develop a truly effective vaccine. If necessary, we shall iterate, and if required, we will identify new antigens. Rest assured that the power of the scientific excellence and the will of our teams at BioNTech made a difference, and I believe that this success can be repeated for malaria. And we will be prepared for success. It is clear to us that a potential future malaria vaccine must be produced in Africa for Africa. Here, by the end of this year, we plan to have a setup of our first state-of-the-art mRNA vaccine factory. Our BioNTainers are high-end, fully digitalized, modular mRNA manufacturing facilities, allowing to produce up to 100 million vaccine doses per year. We anticipate that we can start manufacturing of first mRNA vaccines here in Rwanda end of 2023. Similar modular vaccine factories are planned to be established in Senegal and South Africa. We believe that these are ambitious goals, but I personally believe that goals must be ambitious to be attractive. Sometimes an ambitious goal is easier to achieve than a non-ambitious one. We will do our work in a collaborative manner. We are currently supported by world-class experts in malaria, by the Bill and Melinda Gates Foundation, by the Kennap Foundation, by the European Union, by the African Union, by national regulatory authorities, by the WHO, and many others. I would like to thank our team and these partners for their continued support.
Your Excellencies, distinguished members of the Commonwealth, our unity, our shared values and aspirations couldn't be more critical. At this unprecedented moment in human history, it is only the continued steadfastness in our convictions that can safeguard our future. And that commitment couldn't be clearer than what you're about to hear. Let me now introduce to the stage our leaders who will articulate this for all of us. Please help me welcome first on stage His Excellency the President of Botswana, President Mokgweetsi Masisi.
Your Excellencies, heads of government and distinguished guests, Mrs. Melinda Gates, Dr. Tedros, Director General of WHO, it gives me enormous pleasure to be here to share with you and confirm to you Botswana's commitment to ending malaria and to addressing comprehensively neglected tropical diseases. The reasoning for it and the rationale for so doing has been amplified by previous speakers, but I'd like to re-emphasize it from the perspective of Botswana. We have spent consistently for most of the years of our independence, which are just over 50, in excess of 20% of our budget on health. In spending on health, we have built what we believe are resilient health systems, and we continue to improve the efficiencies of such with support of partners such as WHO, so that we are in a better position to respond to pandemics, including to fight against malaria and NTDs to yield healthier populations. We know that in 2018, the Commonwealth committed to halve malaria across the Commonwealth by the year 2023 and eliminating blinding trachoma by 2020. Botswana, for your information, has been put on the WHO category of countries for malaria elimination by the year 2025. Over the years, we have reduced the burden of malaria incidence from 10.07% per 100 per 1,000 people in the year 2008 to now 0.3 per 1,000 in 2021. Parallel to that has been the significant reduction in case fatality rate from 9.99 to 6.72. The key interventions put in place include surveillance, enhancing and optimizing case detection and case management, optimizing vector control, as well as strengthened public health education. And yes, I'd have to agree with Melinda Gates, the women were right in the forefront of this. And working in partnership and collaboratively through cross-border initiatives. These key interventions aim at attaining the following key strategic objectives, which are achievement of universal coverage of appropriate preventive and treatment interventions for all populations at risk of malaria in all transmission areas, strengthen social behavior communication and community engagement, and strengthen capacity of the National Malaria Program for effective leadership and coordination of malaria elimination. With regard to neglected tropical diseases, Botswana recognizes the critical importance of investing in the fight against these diseases, restoring dignity and health to communities and individuals particularly affected by NTDs. Neglected tropical diseases continue to disproportionately affect impoverished communities, pushing them into deeper poverty and disability, a situation we can no longer ignore. As a country, we acknowledge that though there has been significant reduction in the number of cases registered over the years, to remain on track, the country conducted a rapid assessment of CHOGM in 2019 in one district with a view of expanding such survey to fully quantify the extent of the problem through the support of site savers. We do acknowledge that the consequence of NTDs stretch beyond the health sector, greatly denting our economies, particularly of African countries, and that the suffering of our people is unnecessary. However, one notes with concern that over the years, neglected tropical diseases have seen a gradual reduction in funding. But refreshing it is this afternoon to hear the announcement of this new funding. To conclude, one must note that the COVID-19 pandemic resulted in a disruption of primary care services, which included advancing preventive interventions for both malaria and NTDs. We call on and ask for support for building resilient healthcare systems through the revitalization of primary health care, which is appropriate. And I urge leaders of the Commonwealth to avail more resources, to be committed to this agenda as we build back better. And it's always best to begin with your own domestic resources. We say this with the conviction of the experience we have in Botswana, where we did it and we will continue to do it. Thank you.
Thank you very much, Mr. President. Ladies and gentlemen, distinguished guests, please help me welcome on the stage now His Excellency Dr. Philip Mpango, Vice President of the United Republic of Tanzania.
Excellencies, distinguished delegates, first I wish to convey fraternal greetings from Her Excellency Samia Suluhu Hassan, the President of the United Republic of Tanzania. Her Excellency wishes this summit great success. Allow me also to thank the government of Rwanda for convening this summit to review the progress made since our 2018 commitment to halve malaria across the Commonwealth by 2023, eliminate blinding trachoma by 2020, and to combat other mosquito-borne diseases. Excellencies, efforts to achieve our commitment have been challenged by the onset of the COVID-19. The pandemic placed an extra burden on health systems, and in particular in countries with fragile health systems like Tanzania, on top of the existing threats to public health, especially malaria and other NTDs. However, Tanzania was encouraged in 2021 when the World Health Organization endorsed a malaria vaccine that has proved to significantly reduce malaria in young children. Excellencies, distinguished delegates, it is very important that our recovery plans to strengthen public health systems include robust action to end malaria and neglected tropical diseases. In Tanzania, we have, in cooperation with our partners, been able to scale up coverage of malaria vector control and case management interventions. As a result, Tanzania has experienced a marked reduction in malaria prevalence to hypoendemicity level. In recent years, Zanzibar and 5 regions of mainland Tanzania, which account for about 16% of Tanzania's population, have been able to reduce malaria prevalence to less than 1% and target to reach zero malaria by 2025. Among the major interventions that were implemented include indoor residual spraying by using blanket spraying, real-time monitoring by using smartphones, and strengthening malaria diagnostics. Tanzania is also currently implementing a 5-year national malaria strategic plan, 2021 to 2025, aiming at reducing average malaria prevalence to less than 3.5% in 2025 from 7.5% in 2017, and eventually eliminate malaria by 2030. Excellencies, distinguished delegates, besides malaria, neglected tropical diseases constitute a significant public health challenge in Tanzania, with over 29 million people requiring treatment of at least one NTD. To address this challenge, Tanzania integrated the coordination and implementation of 5 preventive chemotherapy NTDs control and elimination activities, including mass drug administration, health education, and morbidity management. In addition, Tanzania is currently implementing a 5-year strategic master plan to the Neglected Tropical Diseases Control Program 2021 to 2026, which aim at sustaining the gains made to control and eliminate NTDs and scale up disease monitoring and surveillance. As a result of these interventions, we have, in collaboration with our partners, been able to attain full geographical coverage for mass drug administration in all of our districts. Transmission assessment and surveys indicate significant decline in prevalence of all the 5 NTDs. The number of districts requiring mass treatment against trachoma has declined from 71 in 2012 to only 9 by February 2022. And the number of people requiring surgical interventions for trachoma has declined from 167,000 in 2012 to 13,401 by February 2022. Excellencies, distinguished delegates, in conclusion, the United Republic of Tanzania reiterates its commitment to scale up malaria and NTDs responses. We call for partnership and heightened stakeholder collaboration to increase investment in preventive measures, diagnostic testing, treatment and disease surveillance, as well as harnessing innovation and expanding research in order to accelerate our pace to meet the 2018 commitment. I thank you.
Thank you, Mr. Vice President, sir. And now, His Excellency Sheikh Shakbut bin Nahyan Al Nahyan, Minister of State in the Ministry of Foreign Affairs, the United Arab Emirates.
Guests, partners, and delegates, a warm welcome to you all. I would like to start by thanking His Excellency President Paul Kagame and the government of Rwanda for the generous hospitality and our esteemed partners at the RBM Partnership to End Malaria. Malaria No More and Uniting to Combat NTDs for convening global champions of disease elimination here in Kigali today. On behalf of His Highness Sheikh Mohammed bin Zayed Al Nahyan, President of the United Arab Emirates, it is a privilege to gather with you at the Kigali Summit on Malaria and NTDs. Today marks a significant milestone and other step forward in our journey to end diseases that impact daily lives and futures of millions of vulnerable people around the world. The UAE has been a committed partner on this journey since 1990, when our nation's founder, the late Sheikh Zayed bin Sultan Al Nahyan, partnered with the former US President Jimmy Carter on a campaign to eradicate a parasitic disease that was causing devastation across a large part of Africa, guinea worm disease. We are proud to continue Sheikh Zayed's legacy today by signing the Kigali Declaration on NTDs and to reaffirm the commitment of our President, His Highness Sheikh Mohammed bin Zayed Al Nahyan, to ending NTDs and malaria. Thanks to the guidance of our wise leadership and the unwavering support of our valued partners, we have seen incredible progress. We join the international community in celebrating the 46 countries that have eliminated at least one NTD. The year we celebrated a historic low of just 15 cases of guinea worm disease in 2021. And thanks to a decades-long effort by the government of Niger and international partners and recent support from Reaching the Last Mile Fund. An initiative championed by His Highness, Niger is poised to eliminate river blindness, a first for Africa. We have also been encouraged by progress against malaria through the work of the Global Fund and the RBM Partnership to End Malaria. The UAE continues to support these efforts while also piloting new innovations to ensure their sustainability, like our Forecasting Healthy Futures initiative, which works to integrate climate considerations into national malaria policies. We have also been encouraged. We also have come so far on this journey together We know that there is still some way to go, and the last mile is most challenging. The next stage of our journey will require innovations to accelerate our work, sustained investment to build resilient health systems, and increased collaboration. Today, the UAE reaffirms on our belief that no one should suffer from a preventable disease. And as we look forward to the next Reaching the Last Mile Forum, we commit to pursuing innovative solutions and long-term partnerships that can accelerate the path to ending NTDs and malaria. Together, we can reach the last mile and secure a safer future for all. Thank you very much.
Thank you. And now, ladies and gentlemen, please welcome on the stage Honorable Dr. Osagi Ehanire, Federal Minister of Health for the Federal Republic of Nigeria.
Your Excellencies, Honourable Ministers, the Director General of the World Health Organization, the co-chair of the Bill and Melinda Gates Foundation, ladies and gentlemen. My name is Osagi Ehanire. I am delivering this speech on behalf of His Excellency President Muhammadu Buhari, President of the Federal Republic of Nigeria. I'm delighted to be at this summit on malaria and neglected tropical diseases, convened as part of the agenda of the 26th Commonwealth Heads of Government meeting here in Kigali, which invites leaders to rededicate themselves to tackling the scourge of malaria and neglected tropical diseases, NTDs, still posing significant public health challenges to the global community. Your Excellency, is a theme which is unlock the potential, ending malaria and NTDs to build a safer world, calls for multi-sectoral and multilateral collaboration among governments, funding and implementing partners, research institutions, the private sector, civil society, and affected communities to reinvigorate our approach to malaria and NTD program implementation. Estimates of the persons in the WHO Africa region contracting malaria is still in hundreds of millions, while fatalities are still in hundreds of thousands, the greatest toll being on pregnant women and under 5-year-old children. With regard to neglected tropical diseases, Africa bears more than half the global burden, estimated at over 1 billion in 149 countries. Nigeria has made progress in tackling NTD across the board, including the elimination of guinea worm. But we are also promoting the inclusion of NOMA, otherwise known as Cancrum oris, in the list of NTD. It is therefore important to join forces to end this double disease burden by urgently scaling up innovation and deployment of new tools while advocating for equitable access to tools for prevention and treatment. The journey to end NTDs has been defined by partnerships among a wide range of stakeholders. In 2012, the world's biggest public-private partnership, which included industry partners, donor countries, private philanthropy, research institutions, civil society, came together to commit to the first WHO roadmap as part of the London Declaration on NTDs, which paved the way for development of the Kigali Declaration. The Kigali Declaration, built on the London Declaration, put individuals and communities at the center of response and focused on an 8-point agenda which committed governments to accountability, integration of NTDs with other health programs, increase in domestic resource mobilization, innovative practices in diagnosis and medicine supply, transparency, and monitoring program implementation. This partnership can be expanded with affected communities still at the center to meet the UN's Sustainable Development Goal and achieve goals endorsed by member states in the WHO NTD 2021 to 2030 roadmap. The 2021 World Malaria Report found many endemic countries not quite on track to meet the WHO Global Technical Strategy target to reduce malaria infection and deaths by 90% or more by 2030. The country-led high burden to high impact approach launched in 2018 by WHO and the rollback RBM partnership was adopted by Nigeria and should reignite the pace. It is in furtherance of this that the establishment of a high-level multi-sectoral End Malaria Council has been approved to ensure domestic and public-private resource mobilization and keep malaria high on our political agenda. Despite the COVID-19 pandemic, Nigeria managed to deliver on commitments made at the London CHOGM Malaria Summit in 2018, which included securing $300 million from the World Bank, and the Islamic Development Bank to cover essential malaria programs and to strengthen primary health care in those states previously without external financing, which clearly demonstrates Nigerian government's commitment. I note that across Africa, similar commitments have been made and strong country leadership has been demonstrated. However, more support from our partners, especially our external partners, will be required. With the 2022 Global Fund replenishment at hand, US $18 million is required to ensure we get back on track for HIV, TB, and malaria programs, and to support resilient health system strengthening for our sustainability plan. I urge friends and partners to show global solidarity and back this ambitious endeavor. I'm pleased to say my country has recorded gains in reducing the burden of malaria at NTDs and averting millions of malaria infections and deaths, as reported in the 2021 World Malaria Report. In spite of COVID-19-induced restrictions, Nigeria distributed over 17 million long-lasting insecticide-treated nets for vector control. LLIN prevents not only malaria, but also NTDs transmitted by mosquito vectors. To protect against malaria in our seasonal malaria chemoprevention strategy, we were able to scale up beneficiaries from 9 million to 21 million, and 9 million in 2021 to 23 million children. Your Excellencies, the opportunity to renew commitment to continue investing in NTDs and malaria prevention, control, and elimination is here. I call on Commonwealth leaders, countries affected by these ancient ailments, and our development partners to join hands on the path to disease elimination and achievement of universal health coverage, and of course the Sustainable Development Goals. This will unlock the potentials of many countries to fend for themselves and to build a better world. I also believe that we speak for our brother and sister African leaders in assuring of 100% commitment to end NTD and to rid Africa, to rid our continent of disease. I thank you all for your attention.
When it comes to fighting neglected tropical diseases, the commitment of the pharmaceutical industry starts at the highest levels of leadership.
Our companies have resolved to combat these preventable and treatable diseases and to ensure that they are no longer neglected, but prioritized.
Because we've seen how individual lives and livelihoods are disrupted by neglected tropical diseases, our commitment also runs deep.
We've made just incredible progress, positively impacting the lives of so many people and their families around the world.
We are proud to stand with the broader community, the governments, universities, organizations, and individuals around the world.
45 countries have eliminated at least one neglected tropical disease, and Rwanda, our host country, is one of the latest countries to have eliminated sleeping sickness as a public health problem.
We celebrate these successes and recognize that there's still more work to be done.
By endorsing the Kigali Declaration, as well as committing $250 million to discover new treatments against these diseases, we reaffirm our commitment to end neglected tropical disease and malaria.
ESA supplied over 2 billion DC tablets at price zero to 29 countries for lymphatic filariasis elimination, and we are committed to improving healthcare disparities by working with various partners to end NTDs.
GSK's medicine helps to prevent and treat 2 of these diseases. Since 1999, we've been able to supply over 10 billion tablets to endemic countries.
Much more needs to be done still, which is why I renew Merck's pledge to provide up to 250 million tablets of our medicine per year to tackle schistosomiasis in Africa until elimination has been achieved.
Pfizer is committed to fighting trachoma, and we are proud to announce an extension of our commitment to donate Zithromax through 2030.
For 21 years, Sanofi has partnered with the WHO through financial support and drug donations to eliminate sleeping sickness, and continue to work towards developing a novel, single-dose treatment moving forward to eliminate this disease.
We are proud to have donated more than 2 billion doses of our intestinal worms medicine to help countless children in need. And we are working tirelessly and collaboratively to help advance the science needed to beat NTDs like dengue and leprosy.
Today, as representatives of the pharmaceutical industry,
we are recommitting our long-established efforts
and our collaboration with countries and partners
to control and eliminate neglected tropical diseases.
We are 100% committed to achieving this goal.
This summit is about people. We're here for people. And so it's only fitting that we now begin this next part of our program with the community that is most affected by malaria and NTDs. Our first guest is Mr. Tawanda Hodza, a community representative who will speak to us from personal experience as one of the millions of people still affected by and at risk from malaria and NTDs. Welcome, Mr. Hodza.
Distinguished head of state, royalty, ministers and friends, it is an honor to speak before you today. Thank you for taking the time to listen to me and hear my story. My name is Emson Tawanda Hodza. I'm just one. This is my story. I am from Zimbabwe, aged 46 years of age. I have suffered both malaria and elephantiasis. My problem started in 2014, 1st of May, when my leg got swollen. I got fever, muscle ache, and piercing in my bones. I went to the local clinic. but only got painkillers. There was no medication for my condition. After 4 years living in pain, my wife ran away, leaving 3 children with me. The reason was because I was not able to work for the family. I cannot stand for a long time while working. I'm still unable to work and living with my family. While no one in the community give me assistance. In pain, I still have to fend for my family, looking for food, school fees, uniforms, and grow crops for sale, which is difficult in my condition. I would be happy if someone helped me and get my leg normal. The condition is not something I would like to see. I would like to see someone suffering from it. The community call it the elephant man, while health personnel do not even know what to do when it gets this far. There are 1.7 billion people around the world looking for who are like me, having suffered or suffer or likely to suffer from neglected tropical disease. That is nearly 1 in 5 on this beautiful planet. Half of the world is at risk on malaria. That's billions of people whose potential goes unrealized because we do not have a will or the resources to treat people like me. We cannot allow so many billions of people in the world to continue to suffer from preventable and treated disease. We need you, distinguished members, to listen, but more than listen, we need you with the great powers that you have to change our lives, help us unlock the potential of the people like me. We need you to act. We need you to commit to the people, to be committed to the people around the world who are suffering or who suffer from this disease. When billions of people around the world are forgotten because they suffer from this disease and don't have access to health care, clean water, sanitation, we know that the time to make change is come. Let this be the moment when we take the decisive action that is required to address these diseases, to change so many lives, to achieve the targets set out in the Sustainable Development Goals. We need you to act. We need you to endorse and commit to the Kigali Declaration and to mobilize fully resources to save millions from malaria and NTDs. We need you to work alongside people like me around the world who are suffering or who suffer from this disease. We must work together to create a better, safer world for everyone. Thank you for listening to my neglected plea. It's never too late to act. Now is the time. Thank you.
Thank you, sir. Thank you for your courage to tell your story. Thank you for using your voice to advocate for others. Thank you for your call to action. We hear you. Well, as we say here in Africa, it takes a village. NTD work cannot be done alone. Through the support of various civil society and charitable groups, countless people have received life-saving drugs and access to information. Now, one such group is Mission to Save the Helpless. It's a non-governmental organization, and it complements efforts by government by improving the quality of life for poor and rural people through their advocacy and through provision of services to the underprivileged. Please help me welcome its Executive Director onto the stage, Dr. Francisca Olamiju.
Your Excellencies, Director General of WHO, Honorable Ministers, distinguished delegates, the media, good day. First, I would like to join others to thank the government and good people of Rwanda for inviting us to this beautiful country. Thank you so much for hosting us. We felt good since the time we arrived here. I'd like to start by telling you how I got here, and I remained in this group as a civil society activist. In 1995, when I was serving my country, Nigeria, as a young girl, doing National Youth Service in one of the states in Nigeria called Taraba. I was working with an international organization called Africa. One of the days, we were traveling to the highest point in Nigeria, Gembu. On our way, we passed a village in Gashaka area, LGA, if you know Nigeria a little bit. And as we were going, we saw a lot of blind people. At the sight of oncoming vehicle, they didn't leave the road. And the driver had to horn to get them off the road. And I asked my boss that was traveling with me, why are these people on the road? And he told me, they are blind. Actually, Franca, we are passing the village of the blind. I said, so we have village of the blind? He said, yes, we do. These are people that have been blind due to river blindness. You get to the communities, you find father, mother, 2, 3, 4 children, all blind. If you search the history, you will know about Garbabi, you will know about Shimbo. The leader of that organization said there should never be anything like this again in the world. So when we finished that journey, I wasn't happy. I got back, we put together a documentary to tell the story that there are people going blind and there is a solution because there is available medicine to make sure they don't go blind. We put together that documentary. When I finished my youth service in 1 year, I was told that Africa had left. And I asked myself, what will become of these blind people? Are we going to have generations that will continue to go blind? I made up my mind to say no. I'm going to have this documentary shared with everybody that can listen and understand the story. Many thanks to General T.Y. Danjuma, the T.Y. Danjuma Foundation, that believed in this vision. He understood the story and he committed to it. We mobilized resources, and that was what gave back to Mitosat. Mitosat started work just in one state. Now we support 6 states in Nigeria with NTD elimination. Many thanks to our donors and partners that are here. We have the End Fund, we have Site Savers, we have other partners, we have the pharmaceutical company. Thank you all for supporting us. with this story because I got here, I remained here for the past 25 years. But today, I'm representing the civil society organization, the non-governmental organization that have been fighting against neglected tropical diseases and malaria. We are 100% committed to this elimination effort. We must, and we are committed to eliminating these two diseases. You know why? We, as a civil society organization, we work with government at all levels, at the federal, at the state, at the local government, and we implement where? At the community level. We know who are the volunteers. We know the CDDs. We know the volunteers. We know those that distribute the nets. And we understand the burden of the disease, and we work with them. And we are committed to eliminating these two diseases, neglected tropical diseases, malaria, to have a safer world. I must say, as civil society organizations, or NGOs as we are called, non-governmental development organizations, we understand the burden. We know what has been done because we were involved. But beside that, we know what is yet to be done. We understand where we're going as partners, and we make that commitment, 100% commitment, as civil society representative here, to say we are committed to the elimination of malaria and neglected tropical diseases. Finally, before I end my speech, we would like to say that we are all committed, but beyond that, we ask our leaders to please walk the talk. That has been said all over here today, but we need to walk the talk. We would like you to help us get to the target. Work together to mobilize the resources required to meet the target and to end these diseases. Once again, we thank you all for your commitment and your support. CSOs, we are committed 100%. Thank you all. God bless you.
I've had many honors today, and here's another. It is an honor to welcome a man who is leading the fight on the ongoing pandemic, an ally in our corner. Please help me welcome the Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus.
When you're the last speaker, all who have spoken before you could speak or could say whatever you wanted to say. So what do? I just say thank you and leave. I will try to say a few words, but I left my speech there, by the way, because it was all said. But I tried to prepare something. I would like to say miwiriwi first. Amakuru, Muraho, Dagukunda Rwanda. Dagukunda, Dagukanda. You understand? So thank you very much. I'm glad to be here. So after my little Kinyarwanda, I will move into a few words. I will say a few words. But thank you for the opportunity first to President Kagame for inviting me and for hosting this very important event. Murakoze cyane. And congratulations also for the progress in malaria control in Rwanda. Congratulations also for the elimination of human African trypanosomiasis from Rwanda. And congratulations on the high coverage of COVID vaccination. I think single dose is 70%, double more than 60%. So contrary to what many want us to believe, high vaccination coverage in COVID can also be done in Africa, and Rwanda has shown it, and a number of countries, and I hope everybody will. Then, as you know, on malaria and NTDs, because of COVID, there are disruptions, and because of the disruptions, what we have gained the last few years, we're losing them now. So, as a result, we're off track from SDGs. I think even before COVID, it was the same, but now even more off track. So we need more commitment, more political commitment, more energy going forward. Then maybe a few areas where I believe we need to focus is, one, we have to focus on health promotion and disease prevention. That has to be at the center. And then for that to happen, building primary health care is important. So we should focus on building primary health care. Even the wealthiest countries were surprised by COVID because they haven't invested in their primary health care and in their public health. This is not just for, actually relatively, low-income countries were better prepared in terms of primary health care and public health. So investment in public health could really, in primary health care, will help us to fight malaria and NTDs in a better way. But the key is primary health care is not the institution alone or the facilities, but primary health care is closer to the community, and primary health care means community empowerment, community engagement, and especially involving the youth and making sure that the youth owns the programs. And I'm really glad to hear actually from Chido Mpemba, our youth envoy, African Union youth envoy, that we have a good number of youth representatives from Youth Combating NTDs, Malaria Youth Army, and also ALMA Youth Group. By the way, because we believe in WHO that the youth has to take responsibility and has to be engaged, not engaged as owner actually, we're establishing a youth council. And if I am not wrong, Youth Combating NTD is one of the youth council members that's going to be working with WHO. So that's the other, the community ownership, especially with clear role of the youth, will help us to combat malaria and NTDs. When we talk about community ownership, one other focus area which I would like to underline is the focus on behavioral science. We normally neglect it, but that's actually central. It's our behavior which can have a significant impact in fighting malaria, NTDs, COVID, HIV, or whatever. So we have already established, as part of our transformation in WHO, a behavioral insight unit, and in every country, especially at the national level, the behavioral part should be considered seriously. Then the other thing I'd like to underline, maybe to make up and to be able to reach SDGs, is development of new tools, and this could include vaccines. And we have inaugurated today the mRNA hub here in Rwanda. That will not be just for COVID, but it can be for malaria, for cancer and other diseases as well. But I think Chimamanda was saying earlier, you have to start with the easy ones and then move, her father's advice. While developing new tools, we already have RTSS, a vaccine for malaria, and we have to invest in order to make use of the vaccine that's already at hand. Then the other important element we need to focus in order to catch up or compensate for the disruptions during COVID is the financing part. When I say financing, not only global or international financing, but domestic financing. When I say youth should be at the center, I think the youth should influence your governments in order to allocate more funding for health, and especially for the neglected, for malaria, and for the diseases that are a priority, especially in countries or in a continent like ours. So that is another focus we need to make. And finally, before, I think I have two things. One is on Mwele. As you know, part of my speech which I kept is just to read about Mwele. As you know, earlier this year, we lost a true NTD champion and a beloved member of our WHO family, our sister, Dr. Mwele Malesela. Mwele made an incredible contribution to the fight against NTDs. In her honor, we're therefore delighted to announce, as Melinda earlier said, together with the Bill and Melinda Gates Foundation, we're establishing the Mwele Malesela Mentorship Program for women in NTDs. The program will provide opportunities for African women working on NTDs to gain mentorship, leadership, training, skills building, and other opportunities. Mwele is no longer with us, but we hope that this program will help to produce many African women to carry forward her legacy. She has been an incredible colleague. She has been working with me closely in Geneva, by the way. We lost her, but continuing her legacy and carrying it forward will be important, and we're happy to partner with Melinda on this program. So I would like to take this opportunity to thank Melinda. Then the final is WHO is proud to endorse the Kigali Declaration, and we will do. And our speaker before me said, what's left is to walk the talk. Walk the talk. And thank you so much. And maybe a last word about Chimamanda. I was standing with her and my daughter, I told my daughter who was standing with me, and she was reading her book. That's why I told her. My daughter was reading Chimamanda's book. I will tell them if you don't mind, Chimamanda. And to Chimamanda, although everybody calls her Chimamanda, I called her Ngozi. And she said, you're the only one actually who calls me Ngozi. So the book she's reading is Purple Hibiscus from Chimamanda Ngozi Adichie. And she told me, when my daughter told me about Chimamanda, she said, she's really, really cool. And that her TED talk was nice. And she was really proud of her heritage. My daughter is 15 years old, and I was so happy to hear, especially the last one, proud of her heritage. And I was proud of my daughter. Her name is Blen, that she was following her, actually. She was following her, and means my daughter is also proud of her heritage. I think we have to be proud of our heritage. We have to be proud of Africa, and we have to do everything to develop it. No? So that was our conversation with Ngozi Chima. And thank you so much again. I'm the last speaker, so I didn't mind to take more time. But such a great honor. I listened to all speakers and learned a lot. And now it's time, as the speaker before me said, to walk the talk. Thank you very much. Thank you.
Thank you, Dr. Tedros. Thank you and best of luck. We're not quite yet done, but like his daughter, I'm very pleased that I'll get a little help a little later on from an award-winning author. But first, what can I say about the incredible Sherry Silver, a dancer and an award-winning choreographer who graced our stage earlier today? She has been personally affected by malaria. She joins us now with her story. Please welcome Sherry Silver.